Yes, sir.
Question effective.
We're going to give you a microphone so it gets recorded. Thanks.
Question would be the effective date of the two FLSA changes?
From the best that I can remember, I believe they're upon enactment. Yep.
Also in regard to the FLSA changes, how the nursing mothers don't need to be compensated during breaks, how does that impact the exempt employees?
That's a very good question that I do not have the answer to. Why don't we talk after the program and we can try to find you an answer?
And I had one more question regarding the health FSA that needs to be reported on the W-2. Does that also mean that the dependent care needs to be reported, or is that strictly just for the health?
No, it's strictly just for the health. The statute doesn't refer to the dependent care. And actually, on the W-2, the health FSA is excluded. You're not reporting that on the W-2.
Regarding your comment about the FSLA effective immediately, does that mean we're out of compliance today?
Potentially. We will look into the exact effective date and put it on our websites, so that way you can refer back to have that question answered, since that seems to be a pretty important question. So if you'll check on our website the next day or two, it should be up there.
So if you require the nursing mother to clock out during the time that she's going to do that, but you don't require other people to clock out during a break, is that discriminatory?
And that's a good question, because the statute specifically says that you're only required to give reasonable break times, and you do not have to pay them during those break times. So I don't know how, it doesn't make sense that you'd be at one point saying, no, we don't have to pay you for this, we have to give you this time, but at the same time that's discriminatory, because those two things are rather mutually exclusive. So my tentative answer would be no, that wouldn't be discriminatory, because the law is requiring you to provide that time, and obviously only a female can provide nursing for the child.
It could be, though. If you, employment law-wise, if you're providing break time and paying non-nursing mothers for break time and not others, I think it's saying in addition to, if you're providing additional break time to nursing mothers, that you don't have to provide them additional paid time. But you have to look at the break time you're providing to non-nursing mothers. So you want to be careful. Check with the Employment Council about that. Employment Law Council.
I might just add that the law says you don't have to pay them for this time. But like with a lot of laws that we've had to implement over the years, sometimes employers are going to err on the side of administrative ease, and they may just pay them for it and overlook it. It just says that you don't have to. It doesn't say that you can't.
A point is, this is not a subtraction from the paid time that's provided to everyone else. This is an additional break time, and this additional break time is not required to be compensated. That's the way the statute is.
There was a lot of reference to full-time employees. Is there a definition, or is it?
You're right, there were a lot of references, and unfortunately not all the references are defined the same. So let me tell you, in most of the law that I reviewed, it's not full-time, but it is truly full-time equivalents. So 50 employees who work 20 hours a week would be considered 25 FTEs. I noticed a couple places in the law where it didn't go FTEs. It truly meant bodies, like when you look at COBRA, it included seasonal employees and part-time employees as full-time equivalents, but most of it refers to FTEs, so you take the number of hours and then decide how many FTEs you have based on that in most of the areas.
But I thought there was some reference to providing it only to full-time employees.
There's a couple references where forget about the hours. We're just talking about full-time employees, don't count the part-timers, don't count the seasonals. And the problem with this, much like the regulations in highly compensated and key employees, there's 4 or 5 definitions if you do the discrimination testing. Unfortunately, there's not one consistent definition for a full-time employee in the PPACA or the Reconciliation Act.
The most troubling thing that I'm seeing right now is this 2014 when you get this $95 penalty. Am I reading that right, saying that individuals can opt out of our plan, and then if in fact they have a catastrophic situation where they're in the hospital or whatever, that they can come on our plan with no pre-existing clauses? Am I reading that right?
That's a very good question. Back to my comment on certainly within the exchange as well. You know, going out. Imagine the exchange is this big board where you go on the internet and maybe purchase a policy. Certainly, that is the risk if there's no pre-existing, no limitations anymore in terms of lifetime. Yes, certainly that could be a risk to the health plan and to the insurance market as a whole. That's correct.
Regarding coverage for children to age 26, does that apply for dental and vision plans too, or just medical?
Our interpretation is that it does not, and the only time it would apply to dental and vision and it's very rare, although it used to be kind of common in the late 80s and early 90s, where you combined or aggregated your health plan with a dental plan and with a vision. When you enrolled in one, you were enrolled in all 3. But our interpretation right now that it would not apply to those 2.
Dan? Dan Wentz?
Yes.
Do you know yet whether or not it's going to be applicable to church plans?
Generally speaking, most of the provisions will not be applicable to church plans. A major portion of the materials you saw here are through the Public Health Safety Act, which does not apply to church plans. And there are some things we're going to have to pick and choose through, but much of what you've seen applicable here, church plans are exempted. Governmental employer plans are in the same boat as everybody else, with a few exceptions.
Before the next question, I might just add, because if it didn't come up, I was going to bring it up. I've been asked by employers, well, all these laws and rules are great. Does it apply to federal and state and governmental and municipality employees? It does not. So it's really only to the private sector.
Hey, Tony, what is the definition under the PPACA of a dependent child?
That's a good question. We're getting some conflicting reports. Early on, under the PPACA, we were told that it had to meet the qualifications of Section 152, which means tax dependent. And not to go through all those, but you gave half of their support to them during the year they lived in your household 12 months. Under the reconciliation bill that was passed a week later, it is appearing to be because they stated that this person could actually be married, that it does not have to meet the definition of a tax dependent. I don't know if Brian or Dan wanted to weigh in on that, or
I agree, it does not.
I think we're all in agreement that it does not have to be a Section 152 tax dependent. I can barely see you over there, Steve.
But is there any type of guidelines on determining what the dependency is? If they just live under your roof and they're up to age 26 and they're married, that qualifies?
Well, and they have to be obviously biological or adopted child, that sort of thing. But beyond that, is anybody aware of?
If they're in your basement.
Yeah. I've got a basement full of dependents if you'd like one.
I'm sure most of us do.
Yeah.
When they talk about providing a summary of benefits in a culturally and linguistically appropriate manner, do you foresee threshold in terms of number or percentage of employees?
Because HHS is tasked with developing regulations governing the summary benefits document, I would suspect that they will give us a threshold. Like if you have X number of employees who are not fluent in English, for example, you have to provide the document other than in English. Absent a regulation, I think the conservative answer would be the culturally and linguistically appropriate language means if you know that you have an employee who is not fluent in English, you're going to have to provide that document in a language other than English. So if the regulations don't tell us, just to protect yourself, the prudent thing would be to provide the document in the language other than English.
There is, it's a rule of thumb, and it's somewhere buried in ERISA, and I can't think of the section right now, but on the requirements for SPDs, if you're looking, gee, if I have one Spanish-speaking employee, there is a guideline out there that says if at least 10% of your employer base isn't fluent in English, then you had to supply it in another language. Now, whether or not that's going to be applicable here, because it really doesn't say, it just says linguistically understandable. But in the past, there was that number 10% floating out there.
I have a quick question about that dependent up to age 26. So for reference back, a couple questions. Isn't one of the disqualifiers if that dependent is eligible for other insurance than they are to dependent on your plan? For example, when they get married and now they have a spouse and that spouse has an insurance plan, can that dependent still be a dependent on mom's plan even though their spouses now have eligible insurance?
It's a great question. Let me try to answer it to the best of my ability. First of all, you always have to look to the definition of dependent under your plan. Always look at the SPD first and see how your plan defines it, if indeed they're eligible. And this is just an educated guess, I'm not even sure how educated it is, but I don't know that I'd use the word eligible for coverage under a spouse's plan. I might use the word covered by someone else's plan. And if they're covered by their spouse's plan, no, they would not be eligible for this eligibility up to age 26. But right now, I would have to take a more expansive look at it and say if they're just eligible but not covered, and they're eligible under your plan given the language in the SPD, that I think they might be eligible to be covered under up to age 26. Right? I mean, it's just a guess, but I think that's the way we're heading. Anybody want to add to that? You're more than welcome to.
We agree with that.
Fraser Stryker and Silverstone agree on something. There you go.
I have another question for Dan. On page 28 on one of the slides that you weren't able to get to, it talks about a $2 per covered individual fee. Is that a fee imposed to employers that can then be passed on to employees and premium?
The fees that are referenced there depend on whether you have an insured plan or a self-insured plan. $2 per head, it applies. So if you have a fully insured plan, there is a fee that's imposed upon each person who is covered by that plan. And that is not just the employee, it's the spouse, it's the dependents who are covered participating in that plan, $2 a head. If it's and that fee is imposed on the insurance company. If it is a fully insured, a fully self-insured plan, that fee is imposed upon the employer maintaining the plan. What we don't have guidance on are what is the usual case, a mixed plan, where we have self-insurance and then we have stop loss, individual or aggregate. The literally read, it appears you could end up with $4 worth of per capita charges. That there would be $2 on the employer, $2 on the insurance company. Perhaps that won't apply if you had aggregate only coverage. But if you had individual stop loss coverage, probably it really seems like it's 2 plus 2. However, we're waiting for the regulations to see if there's going to be some integration, because why should this type of plan be subject to twice as much in terms of fees as a plan that would either be fully insured or fully self-insured?
we agree 1,000%. I'm just going to throw this out as a hope. I'm hoping, as Dan said, that when we get regulations, that Health and Human Services or DOL, whoever looks at this, will say that that reinsurance, whether it's specific or aggregate, fails to meet the test of insurance and instead is a financial arrangement. And if they say that, well, then we might be back to $2. Otherwise, yeah, it could be the 2 + 2 = 4.
Problem is Department of Treasury.
Yeah, and it is Department of Treasury, you're correct. I think I'm asking for the microphone in a different direction here.
It is 10 o'clock. We are on time and on budget, and we're going to stay there. If you've got more questions, just come on up forward. Thank you very much for being here, and good luck.